An update to a story getting a lot of attention this week, but tonight News 4 is reporting a possible solution. A St. Louis area family just welcomed a baby boy, but that birth came with a very hefty price tag when they thought their health plan would at least partially cover. Well, tonight they want others to not fall victim to the company that's left them more than $150,000 in debt.
He's just the best thing that could have ever happened to us.
Allie and Elijah Middlesworth had their son Declan in October, but it wasn't an easy birth.
I went to the hospital with severe preeclampsia.
For the safety of Allie and her baby, days later, doctors at Mercy Hospital decided to induce labor 5 weeks before Allie's due date.
He came out and he was unresponsive. And so 10 minutes goes by, they're trying to revive him, they call in a crash cart, and they finally revive him, and they take him straight down to the NICU.
It was terrifying.
It was days before Allie and Elijah were able to hold their son for the first time, and 2 weeks before they could bring him home.
He's perfectly healthy. He's 3 months old now.
Now, the joys of having a healthy baby have been watered down by mounting medical bills.
My responsibility is $47,481.61.
That's just one statement.
It's close to totaling $150,000.
Allie says her health plan company is refusing to pay a dime.
I feel scammed.
Allie's job doesn't supply her with insurance coverage, so she signed up for Elyria Health.
Throughout the entire pregnancy, they covered all my physician's visits, everything, just like regular insurance.
It wasn't until later they realized the coverage isn't what they thought they were paying for.
And then when labor and delivery hit, that's when they covered nothing.
Elyria is part of what's called a healthcare sharing ministry, which aren't required to follow the same rules as traditional insurers, including paying claims.
It's not even real insurance, but they don't tell you that before you sign up and make your first payment.
Elyria says, quote, member contributions are received by the healthcare sharing ministry and are then used to pay eligible share requests to the ministry's members. So what Allie thought was a monthly premium is actually called a contribution or a gift, which ends up in a money pot and is shared amongst Elyria's members. Allie learned even that has a limit.
Medical expenses for a newborn arising from complications at the time, including but not limited to premature birth, are treated as a separate incident and limited to $50,000 of eligible sharing.
A quick Google search of Elyria Healthcare shows just how confusing it can be. Once you get past the ads, the first website is called Elyria Companies, which doesn't even look like a healthcare webpage. And on Allie's paperwork, it calls her the insured.
It's probably partially our fault for not reading all of the fine print, but no, it's very deceiving.
When Allie added Declan to their plan, she was sent new cards with a new name.
And it was a completely different company. It went from Elyria to Trinity. And at the very bottom of the card, it said in all caps, "This is not insurance," of my new cards. And my first one didn't say that.
Elyria says Trinity Healthcare is one of their clients. But Allie says when they started taking Declan to the doctor, staff wouldn't take the cards because they say this is not insurance.
Monthly contributions are voluntary contributions or gifts that are non-refundable. As a non-insurance membership, neither Trinity Health Share nor the membership are liable for any part of an individual's medical need. All contributors are responsible for their own medical needs. And that just makes my heart drop. Because, I mean, it says that they're not responsible for basically any bills, but yet we pay almost $500 a month.
Elyria sent us a statement. It reads in part, "We are proud of the work we do to help ministries provide a more flexible method for securing affordable, high-quality health care, and we will continue to vigorously defend against false claims about our company." As it stands, Allie and Elijah are $150,000 in medical debt.
We're going to be paying it the rest of our lives.
Allie says their case right now is hanging between Mercy Hospital and Elyria Trinity Healthcare.
They keep telling me that my insurance company has declined the bills, And then I call Alira and they say that they haven't declined them.
Mercy Hospital sent us this in response to the Middlesworth medical bills. In instances where a family does not have insurance, Mercy works with families to see if they would qualify for Medicaid and then otherwise work to provide financial assistance if they can't.
Mercy has been nothing but the best to us, and they've worked with us so much.
And while they're just stuck in the middle, Allie and Elijah say Declan is worth every penny.
I got him out of it, so I mean, he's what matters to us.
Elyria tells News 4 families can file an appeal. The Middlesworths say the company told them it's reviewing $41,000 of their debt, but no money has been paid to this point. According to the Better Business Bureau, the company is facing more than 100 complaints and has a suspended accreditation. Colorado, Texas, and Washington have all sent cease and desist letters to stop them from operating in those states. We did reach out to the Missouri Department of Commerce and Insurance. They told us they couldn't speak on any possible open investigations because their files are closed.